Welcome to the Iron Prescription podcast with your hosts, Drs. Lynette and Stuart. We're both GPs and we're both personal trainers, though we do both jobs in very different ways. We chat about the best things you can do for your health and fitness, and along the way, help you to avoid wasting time on the things that really aren't. Thanks for listening. So we've had some good feedback on the last episode.
Yeah. We have. I mean, a lot of people have contacted me and said, that's fantastic. And actually, I'm really looking forward to hearing about what people who are meant to know about what they're talking about say about the faff that's out there in the industry and all the things that they read on Instagram and Facebook, and whether or not they can trust that information, or whether or not there's a truth behind it and it's just a sales pitch, etc.
Yeah, I agree. And I'm always interested in what people take away from what we say that they find interesting. And there was things that seem normal to me because I spend a lot of time in the fitness space nosying around that other people perhaps wouldn't have thought of. So I'm delighted with that. I'm really pleased that what we've got to say to one another and ramble about is of value to other people. It's good. It's great.
Good.
And based on that was some feedback that you received that gave us the topic for today. In that we neglected to discuss the downsides of exercise.
Indeed. So it was predominantly all positive, but there was one of my clients did say, well, actually, and I know this client really well, and she refers to it as falling off the perch and not being able to get motivated to get back into exercise, and whether that be for an injury or for a medical reason, an event that's happened that's put somebody back quite a bit, they feel this negativity about being able to get back into sport and getting back into exercise. That's really interesting, and I see this a lot in all sorts of clients where they are achieving great things and then something happens, they've paused and they're coming back into it and they're feeling that they're not at that place. And they're right, they're not at that place they were there before. This particular client has done amazingly well. She came from basically nothing, a complete zero background of sport and exercise. And at the point where she stopped exercising, she'd done the London Marathon twice. Mm-hmm. She'd done Swim Windermere twice. She'd done Swim Serpentine. And she'd done Ride London as well. So 100-mile bike ride.
Wow. Things that most people wouldn't do once in a lifetime.
No, exactly. And she was really gaining incredible performance. She had a significant impact on her body physique and her overall psychology and mental health and well-being. And then she ran into a brick wall, basically, and she suffered a medical event. And that was like, well, you need to just pause for a little while. And then when she came back in and still incredibly fit, and then went for a half Ironman. Right. And she was fully prepped for this half Ironman. And she was really, I felt she was at a point where she could definitely do this. It's a 1.2 mile swim, 56-mile bike, followed by a half marathon. And she got into the swim and just thought, I can't do this, and became overwhelmed by doubt and by anxiety of I can't do this, and I've fallen off the perch, mm-hmm. and I am unable to do this, and withdrew from the swim. And after that, the psychological rebound of that was tremendous, in that she felt that what's the point? I can't. I've fallen off this. I've got no motivation to get back to it. Mm-hmm. And it's taken an incredible amount of persuasion to get her back into the gym and get her back exercising. And I see this, and I know from my own journey that you, for whatever reason, you get to a point where something happens, or you just lay off the exercise, and then you feel like when you go back, it's such hard work, and where you were before, you feel like you've stepped back 3 or 4 places and you're letting yourself down.
So you're in the shadow of your former self.
Absolutely. But what I think is really important is that we don't forget where that journey took you in the first place and the reasons why you did that journey in the first place and the huge leaps you made from where you were before, and that we don't ever lose that
Mm,
completely. And there's a lot of research that says once you've been on a fitness journey, you get this thing called base, and
mm.
your base fitness will stay with you. So once you've been fit, the climb back to getting fit again isn't as arduous as you think physically, but psychologically it can be challenging.
Okay, that's interesting. And a couple of patients sprang to mind. When we first bounced this as a topic, I could have literally said, "There's no downsides to exercise, right? Next, and move on." But when I stopped to think about it, my mind immediately went to injuries, which we'll come on to in a bit. But I had to think really hard about patients that I've seen where there's been a negative side to exercise, because most of the people that I see that are injured haven't done it through sport. They've just done it living life. But I immediately went to COVID and a few people that I've spoke to along the way, not anyone I've known in any great depth, but people who on paper should have sniffed COVID away into a tissue and, brushed it off, but weren't. One person in particular was in the first wave and had an ITU admission, and I was seeing him months and months later when he was struggling with much the same as what you've described, and a lot of frustration at various different things, which you can understand, about not being able to get back to what he saw as his baseline, although his baseline being much higher than the average person. And every now and again, I come across somebody who's had, I mean, your client had a medical event. So I do see people, but what you've talked about is mirrored in their experience of holding themselves to such a high standard that they just feel they're falling short of their former self. And as somebody who works a lot with people who have to be persuaded sometimes to do a few more steps a day to get their baseline up, I couldn't necessarily blame the exercise for
Mm.
causing that. It was more of a mindset issue than the exercise per se. But nonetheless, it's branches of the same tree for those individuals, isn't it?
It is. It is. And I think it's quite sad, really, that we allow ourselves to be so destructive to our own well being. In that, like I say, you need to remember we tend to dissect failure into the infinite. Why did that happen? Why did it? Why did it? And
Mm,
we never look at the success and look at the successes and go, actually, why don't I dissect the successes and go, why did that happen?
mm.
Why did I manage to run the marathon? Why did I manage to ride London and ride 100 miles? And we brush that off and go, oh, well, that was just luck. And we
Do you
and we
know who?
don't.
Do you know who I heard saying this very thing this morning when I should have been doing some work and I was faffing around on Instagram? Michael McConaughey making that exact point on his Instagram, because I follow him on Instagram. He's very nice to look at. But saying, why do we spend so long dissecting failure? Spend
Yes,
longer dissecting your successes. And I thought,
yes,
okay,
indeed.
good point. And you've just said
Yeah,
exactly the same thing.
yeah,
So there you go.
indeed. Absolutely. And also, I think rather than going back and going, right, okay, I ran a marathon, I'm going to run a marathon. Well, you're not going to run a marathon because that's not what your body's trained to do at the moment, and you're not at that level. But don't go out and run because you'll only be dissatisfied with
Mm,
what you're trying to achieve. Why not try and do something new? And
yeah.
when you've fallen off that perch, actually getting back into exercise is the ideal opportunity to go. Tell you what, I've never done rowing, for example. I'm going to
Mm,
do rowing, and therefore you have no level
yeah.
to know whether or not you're good or bad. All you've done is you've done it. And you can only get better from where you started. You can't base yourself against it. You're not comparing yourself to yourself because it's something new. And then when you achieve that stimulation and get that dopamine hit again to start doing exercise and getting back into it, then you can switch back to your previous sports and go, right, okay, now I'm at a level where I'm not getting out of breath in the first 10 minutes of exercise and I can try and do that run. Right, I see I can run and I haven't lost it completely. like many people think they have. They think it's somehow been stolen away from them and they'll never get it back.
I guess it needs a willingness to be a beginner again though, doesn't it? I suppose,
It does.
like the
It does.
accomplished musician that leaves one and starts from the beginning again with a whole new instrument, I imagine. And yet all of your former friends and associates are associated with old you. But there's something novel about that. I mean, I've done that in my career and gone sideways and gone, actually, I'm
Yeah.
willing to go back to the table and be a beginner and learn some new rules to play by. So I
You
think you can frame that as a positive, can't you?
do.
Certainly.
In fact, I use that other technique when I've got clients when they've plateaued and they're not getting faster at running, or they're not getting faster at biking, and they're like, "Oh, I'm so frustrated. I can't get better at this." I'm like, "Right, well, let's just bin it."
Mm,
And they're like, "What do you mean?" And I'm like, "Well, just stop it and let's go and do something else, and then let's go back to it."
mm,
Because it's a different stimulus,
yeah.
and the different stimulus works completely differently on the way that it adapts the body and the way the body adapts to it, and also the conditioning that you get from a cardiovascular perspective. Because remember, what we're trying to do, Arnold Schwarzenegger talks about this in bodybuilding. What you're trying to do is you're trying to keep the body guessing.
Mm,
If you just do the same thing over and over and over again forever, you'll become very good at that, but you won't get any growth from that, because your body goes, I know what we're doing here.
mm,
I know how long it's going to last.
mm,
I know what I've got to do. And the body is designed to be as efficient as possible.
mm,
From a historical perspective, we are looking for the easy way out.
mm,
So the body's looking for the easiest way to achieve the task. But if you don't give it that option of knowing what's coming, and you're making the body go, whoa, oh, hang on a minute, I wasn't
mm,
prepared for this, and it's a new stimuli, then you can get a adaptation that you weren't expecting. So if you're on that point where you're plateauing and going, I'm just not getting any further, actually, it's changing the training and doing something else, or bringing in something else. And that's when we know, particularly with weight training, really makes a big difference, particularly with runners and endurance athletes, because they feel like they're not getting any further just doing those exercises, as we talked about a couple of weeks ago. So that adaptation model works really well.
And I think as well, this is where having a coach really pays dividends, because if you're just coaching yourself, or you're a weekend athlete and your only competition is with Strava, which is a competition in itself, isn't it? I came off that because it was just spoiling every bike ride. Um, but having a coach who who can see where you're going and anticipate this and give you permission to stop running at the wall is
Yes.
particularly, I'm just thinking of my own experience of working through a couple of injuries, and one that flares up every now and again with squatting. But the idea of not squatting, who am I if I'm not squatting? It's really hard to let go of, and actually having a coach that can go, nobody really cares whether you squat again or not, and actually there's other ways around this issue. It just gives you permission to go, okay, which is stupid. Like I'm hearing those words and thinking that is a really stupid thing that people who haven't been really into something sport wise might not necessarily get. But it matters. I think it
Mm.
really matters, and that's much harder. So I think if somebody hasn't experienced good quality coaching and
Yeah.
is finding that they are getting frustrated with themselves or running into injuries or not living up to a previous time, then that coaching will be the best money that you spend in order to help shift the mindset, move the needle in a different direction, and find a new joy in sport, because it's not the sport, it's what's tied up in the mindset and the identity and everything that's led you to that place, I would say.
Yeah, I mean, particularly with running, one of the techniques with running, if you've got somebody who wants to run quick, if they want to do a quicker marathon or half marathon, it's actually to get that 80% of their running should be done at a slow pace, and they're like, sorry, no, I'm trying to run faster. And you ask them to run at a pace which is almost a regular comment I get is, I could walk quicker than this. But that stimulus of running slower and the effect that it has on the body makes a huge difference. And I saw on something on Instagram the other day about why people run, and the other reason, of course, when you're running, you should actually be enjoying it mentally
Mm,
and not feel like you're dying.
mm,
time for running and feeling like you're dying, and there's a time for that in all training where you're in that red zone. But that part of meditation where you're just getting that
That
pace,
flow.
that flow,
Mm,
exactly, just that methodical boom, boom, and it's just that pace of life, and everything's slowing down, and you're captured by your thoughts rather than being captured by the run itself.
mm. There's two things from this that are springing to mind, and one is the issue of data and how data driven we've become. Because I like to look at data. I can nerd out on that stuff, and I've had to stop myself sometimes. Of it, I could happily go over to somewhere like Loughborough University and pay for all those metrics and sit in a bod pod and do all of that. But actually, I'm not a competitive athlete, and you have to say, well, how valuable really is this data and what is my why for doing this? But I see this increasingly, whether it's someone tracking their sleep and coming to see me in the clinic to say, am I going to die because apparently my watch said this in the middle of the night? But the Strava mentality of needing to be a bit better on this segment or beat somebody else. I don't see that with my clients, particularly in terms of the coaching that I provide, because they're coming in at a different point and chasing a different goal. You probably see much more of the data disease, do you?
Yeah, absolutely. First thing when you said going to Loughborough and being in a bod pod, my immediate reaction was, "What do you mean you haven't been in a bod pod? Surely everybody's been in a bod pod."
Don't tell me I need to go and pay for that, because I'll go. I'll get my money out
Uh,
next week.
I went to the one at Coventry, and came out and felt devastated. What do you mean? What do you mean? This percentage of fat? I don't know what you're talking about. Look at me. But yeah, so I think data is great. I think I said this before,
Mm,
because it gives you an incentive. But obviously, understanding what the data means and the reality is of what a Garmin, or there are other watches available,
mm.
gives you is limited. But it's very good for you as a baseline of where you're at and how you're progressing. But what you can't do is say, and I think we spoke about this last time, is that it's 600 calories on your Apple Watch is not 600 calories, and you won't know what 600 calories is unless you go to a bod pod and have a thermo.
Oh, the pod pod's back. I'll be thinking about it now and finding reasons why I must go.
Yeah, you're right.
Mm,
I mean, data is incredibly important for a lot of my clients because they want and they see something. They measure success by data, and they become. I think they become consumed by that. So when you say to them, right, I want you to slow down on your runs. I want you to do this, that, and the other. They're like, no, they just want to drive forward for that 4 hour marathon or that 2 hour half marathon or whatever they're trying to achieve. But actually, to do many of those things, what you've got to do is actually you've got to take it back a bit and switch off that red zone and sit more in the zones below, even right down in the sort of green zone where you're very comfortable with what you're doing.
See, I just wonder though, for the recreational sports person, how valuable all of this is. And I was listening to these two women on the train a while back talk about what their Apple Watches had told them about their sleep. Now, they weren't athletes, by what I could gather, but from my earwigging of what they were talking about, they were very much taking it as a given that this was a true reflection of the quality of their sleep. And I really wanted to interrupt, but it would have just seemed weird. And I'm seeing this spill over in terms of, I can totally understand if you're trying to meet a goal and you've entered an event and you're deliberately training to improve, that you're going to need some data, because you can't always go by how you feel on the day. I've had days when I've gone in to lift weights and felt awful, and then actually it's gone okay. And others when I've felt like I've been really on it and then got a bar on my back. And so you can't always go by how you feel on the day. But I do worry sometimes by this tipping over into everything being data driven, right down to sleep and pulse rate, and it just, we had very competent athletes and people probably enjoying stuff more. Is it taking the fun out of it a little bit if you're not trying to compete, would you say?
So I think it can do. I think people can become too consumed with it. There is a place for data, and there's a time where I'll say to a client, just take the watch off and go for a run.
Mm,
I'm not interested anymore on what I'm not interested in the numbers because it's having a negative effect on them.
mm,
Because they're going out and they're running and they're saying, well, I'm not, I ran 8 45-minute miles. Now I'm running 9-minute miles and going backwards.
Yeah.
And they're constantly looking at the watch, and they are not experiencing the run. And sometimes you just have to say, get rid of the data for 4 weeks, and let's see how we re-engage with how it's actually making you feel. Because it's very easy to look at data. It's a bit like looking at your bank account, isn't it?
Yeah.
If you don't look at your bank account, you feel great.
Mm.
But if you watch your bank account all the time, you're likely to not
Mm.
feel so great about it.
Yeah. Yeah.
It's one of those, yeah, one of those effects that we
Yeah.
we have ourselves.
So what about injuries? Because that was immediately where my mind went when I tried to think what the downsides of exercise would be. And, on the one extreme, I'm thinking of a patient who I did a home visit on many, many months ago, who there is not a chance that he will listen to this podcast and recognize his story, but he was in his 80s and he'd had a hip replacement. And I'd gone out on a home visit, and his wife was very frustrated because he'd kind of taken root in the chair in the corner of the lounge and wasn't really prepared to move very much. And I said to him, are you doing the exercises that the physio said? And he said, well, I've planned to do them when the stitches come out, when the staples come out, not before then. And I thought, wow, this man really is not going to be doing these exercises anytime soon. So you've got this extreme, which obviously I see more of in general practice, people who will find any tweak, pain, twinge at all as reason to stop everything. And on one level, we have to acknowledge we are wired to pay attention to pain. It's
Hmm.
helped us evolve very, very well. And then on the other extreme, we've got people who will take the no pain, no gain, the Dave Goggins, just get through it, push through it, and who can actually train through injuries and make the problem worse. And I've been guilty of this, of being so determined that to ignore a particular niggle in the shoulder that I've trained through it and probably extended the whole thing by months because I wasn't prepared to listen. Um, as I said earlier, I think more people get injured just living their life in the normal way than they do through sport. But there are, sports injury clinics and
Yeah,
sports medicine doctors for a
yeah,
reason, and it probably touches on what we talked about last time
yeah,
with the marginal gains, is that the closer you get and the more specialized you become, the more the risk starts stacking up that you're going to work your body to its extreme, and it's going to push back at
yeah,
times.
yeah. I mean, my advice to my clients is if there's an acute pain when you're doing something, that's always a good place to stop.
Yeah.
Acute pain is not something you should encounter. A pain that is constantly there with a movement or is exacerbated by a movement is something to discuss and not to train through. And there's always a way around. There's always a way of adaptation of the exercise to remove the possibility of exacerbating the injury. So it doesn't matter what exercise you're doing. There's a way of changing that exercise to making it possible that you can still benefit from exercise, but you can't do that specific exercise. And I also find that I say to clients, if you're doing something and it's hurting, tell me, because it's more likely than not, unless it was an acute event, it's your technique.
Okay.
And form is
Yeah.
incredibly important in sport. And watching, I see people down the gym, they walk in, they put as much weight as they can on the bar, and they go straight for that deadlift,
Mm,
and their form is absolutely
mm,
horrendous. And you just think, well, you're on a one way there to probably getting
mm,
injury, not definitely, but probably getting an injury. And you're far better off with less weight and getting the form proper,
mhm,
and and then you're likely to get more benefit and more adaptation by doing it properly than you were with a poor form. Because with a poor form, the way, just for those people that don't necessarily understand what we're saying, is if you go and do an exercise that's meant to isolate your bicep, for example, and you're using your shoulders to get it
mm.
up, you're not exercising the bicep. So
Yeah.
forget about looking for your guns in the mirrors, because they're not happening,
Mm,
because actually you're having to use your body weight to move the weight. And what you'd be far better off doing is reducing the weight to a point where you can actually isolate the bicep and use that on its own, rather than having to use other muscles to achieve the same exercise.
I see this with a barbell squat all the time. And people want to feel like they're getting better and put weight on the bar. We all do. That's the measure of progress. And then invariably, sometimes it's unconscious. Sometimes, well, it probably is always unconscious. But if you're not being coached and somebody's not watching you, what will happen is the squat goes from being a nice full depth squat to a bit higher and a bit higher until you've eventually got somebody who's just about flexing the knees and then racking the bar and going away and telling themselves they've squatted a weight that they think is a new record for them. And I liken it to altering the scales before you get on. If you if you're going to weigh yourself and you adjust the scale with that dial beforehand, then
Yeah,
you're just kind of kidding yourself, really. You are much better to keep the weight on the bar, hit the depth, because what you're doing this for in the first place. You want to train the maximum amount of muscle over the biggest range of motion in a time
yeah,
efficient way so that you can get on with the rest of your day. And you're fooling yourself, really. Yes, you're putting the risk of injury up because you then are deluding yourself that you can handle a certain weight. Take that
yeah,
into another setting. If you're in another gym or you're at home, or God forbid, you've got a group of people around you who are watching what you're doing, the likelihood is you probably aren't strong enough to handle that weight. And you've kind of done yourself a disservice, really. So I think those things are really quite sport specific. And then again, just thinking of somebody recently who's been making brilliant progress with strength gains, and then goes into an everyday situation feeling really strong, moves some furniture, and puts their back out.
yeah,
Um, you know, it's great to feel strong. It's great for it to carry over into everyday life. But the reality is, if you're moving furniture, you've probably not done a warm up. The load is going to be slightly awkward. Your body's going to be at different angles to what you're used to, and so this is probably another scenario. And I'm guilty of this as well, whereby, yes, of course, the strength that you've accumulated carries over, and that's one of the selling points and the reasons for doing it. But occasionally, you have to pay attention to how that carries over. And hopefully, when I'm coaching, I put this across to people in that it is about making sure that you're stable, because this overhead press that you're doing could be you getting a suitcase off of an overhead carrier. But so the things to pay attention to matter. But I guess in the heat of the moment, when you're moving furniture or moving somebody around, well, sometimes these things can happen, and it is part of life. It is part of one of those things,
yeah.
that at some point, if you live long enough, it's going to happen.
Indeed. I think that's we've talked about this the last time that I particularly like dynamic fitness. That you're preparing the body to be able to lift more by using weights and structured weight lifting, but then you put in things like sandbag lifts where it's an
Mm,
awkward shape. It moves. And you don't hold it in the same way as you would a barbell, because that will prepare you much more for what life is going to ask you to do, and life isn't going to ask you necessarily to go and lift 80 kilos, 90 kilos
mm,
strapped to a bar. It's going to ask you to
yeah,
move that in a weight, in an object that isn't balanced, and isn't necessarily at the same height as you would normally lift from the floor, etc. But what the weightlifting does do is it gives you that core muscle strength to be able to adapt that and use it in a dynamic way.
yeah. I think one of the struggles I've come up against is where somebody has had an injury with lifting weights, can be years before, but it's left a bit of a scar, and I can understand that, and therefore they want to avoid all sorts of weight training, and that can be quite a challenge. I come across that in surgery sometimes, when I will sometimes just try and probe if somebody has thought about strength training or doing strength training, and they push back straight away with either they hurt themselves once upon a time doing something in the gym, or somebody very close to them hurt themselves, and it becomes this barrier to all of that takes quite a bit of work, I found, and isn't really achievable in a GP consultation, because it just
Yeah.
isn't long enough to unpick it. But it's a bit easier from a coaching side.
So I think I went through this journey myself. I had a prolapse disc, a C6 prolapse
Oh,
disc, and gave me a radiculopathy, a pain spreading down to my arm, which was absolutely agonising. And it happened not in the gym but at work, and I'd twisted to. To lift a heavy weight in a way that I wouldn't normally do, and I'd got away with it before multiple times, but boom, there we
mm,
go, back. That was it. And that really, put me back several weeks, and I ended up having to have a injection into my spine for anterior approach, CT guided, awful. And I was like, oh, you know, actually, is this the end? Is this actually, should I just grow up now?
Mm,
And maybe I've been trying to convince myself that I'm something that I'm not, or etc. etc. But what I found was that yes, uh, I got an injury, but actually, what made it better for me, and what made me deal better with it, was not stopping. And what my spinal surgeon, I saw a spinal surgeon, and he said, whatever you do, when we get over the acute phase of this pain, whatever you do, do not stop doing what you were doing before. I want you to get back into it, and I want you to do it, because what we need to do is brace that injury, and make sure that the body doesn't get this feedback loop of
mm,
dangerous.
mm,
Because you end up in that, then without an injury, without even having an injury, the body will send an impulse saying, you're going to have this injury. This is
mm,
going to happen again. And of
mm,
course, the chances are it isn't going to happen again. But what we're doing is you're training the body to expect the pain.
mm.
And I see this a lot in lower back
Oh
injuries.
gosh, yeah.
People get a lower, I had lower back injury, slipped my disc
Mm,
uh, in 1957, and
yeah.
since, um, and of course, what it is that disc may have prolapsed in 1957, definitely,
Mm,
but the pain you're experiencing now is nothing to do with a prolapsed
mm,
disc.
mm,
It's your body going into, and they go, and it's a spasm,
mm, mm,
not a disc. It's not something that lasts a long time. It's a spasm of the body remembering the injury and saying, "You
mm.
did this before," and but you've got those sort of spasms is something you've got to work with to actually convince the body that this is okay and I am strong enough to be able to deal with this.
Yeah, and I do find if you've got somebody in front of you, then it's quite easy to be able to demonstrate to them just how tight the spasm is, because you can almost provoke it if you happen to see them when
Yes.
it's acute. What's
Yeah.
difficult is where historically people have had this, and I completely agree. People get fixed on this idea that a prolapsed disc just stays there forever and that's it, it's never going back in. And 20 years on, they still make reference to it. This is this is one of the downsides of data again, in that we know that the studies show undoubtedly that scan findings and symptoms have a very, very poor correlation.
Yes.
But this idea that if you can see it, it must make sense. And I do get that. You know, when I've had injuries, I've thought, God, I just wonder what's going on fleetingly, and then you get on with your day and you forget about it. But the temptation, especially if people are insured, and MRIs are becoming much cheaper now to access. I think around here, I heard the other day, there's somewhere really quite cheap that you can get an MRI and get the report on the day. So that'll be interesting to see how that trickles through into normal general practice. But it's not always helpful. It's not always helpful to have that picture in your mind, because it's not going to go. You're not going to get the healed picture when you're
No.
feeling better 6 months down the line. And if it's
And
not
also,
amenable to surgery, then what are we doing it for?
yeah. My surgeon was really good with my neck, and he said, we'll MRI, we'll do the MRI. But whatever you see on this scan, understand that there is very poor correlation to what you're
Mm,
seeing. And we're only concentrating, although we'll have an image of your spine, we're only looking at where the symptom is, because
mm,
I guarantee you the rest of your spine will look shot.
yeah.
I was 50 years of age at that point. He said, you've led a very active and foolhardy life,
Mm,
doing lots of things that involve falling over, not
mm,
drinking, unfortunately, but sort of extreme sports and skiing and mountain bikes and motorbikes, and falling off of those at high speed will have resulted in small injury, wear and tear, and therefore your spine will look like that
mm,
of a 50-year-old male that has exposed his body. And sure
mm.
enough, there wasn't a part of my spine where you wouldn't go, well, actually, there's an osteophyte there, and that looks a bit of a closed. That
Yeah,
gap is narrower than the one above, and yeah. So you
yeah.
know, you have to understand that if you have a scan, if you have anybody has a scan for a start, I mean, that's probably an important part to say. You get these life scans. You can get a life scan, CT, a whole body, to see
Mm.
whether you've got
Oh
anything.
God.
Um, well. the data shows that every person on average will have 3 abnormalities.
Yeah, I can well
And
believe that.
and then what do you do with that abnormality?
Yeah, yeah,
You know, causing any symptoms. And undoubtedly, some of those abnormalities, we know that certain scanning uh, really does save lives. So mammograms,
yeah,
classic example. And we know that mammograms are only good at a certain age.
yeah.
That actually before you get, if without being high risk, we know that those result in a lot of false positives in the younger tissue. So, and the same with ECTs, you get these abnormalities and you're like, well, now we've got to stick a needle in it to find out what
Mm,
it is,
mm,
and that carries risk.
yeah.
So you've got to be very careful with what you scan and when you scan it.
Yeah, and I think I found certainly when I was doing some general practice for a private provider where people were using us as GPs mainly to be able to use their insurance because they needed the GP referrals. So there was often this, can you just refer me for a scan because my back's been hurting for a couple of weeks. And I'd say about 70% of people were when I explained that to them and said, well, what are you going to do with the report anyway? If it's only been for a couple of weeks, have we given it
Mm,
time? This is what the data shows. About 70% of people would have gone, oh, okay, all right, fair enough. You got a point. Yeah, I'll carry on. Because actually, people are busy and going for a scan can be a bit of a faff. But
yeah,
probably the other 30% were, well, I'm insured and I want to use it and I want to get my money from it. So I want these pictures. And I didn't, resist too much with those people. But I've seen it. I always remember this lady, she was somewhere in her 70s and she'd cycled all of her life. And she came to see me because she'd lost flexion in her knee. She'd no pain in her knee at all. But it was driving her mad because she had to do this maneuver near the curb to be able to get her leg high enough to be able to get onto her bike and carry on cycling. So we did an x-ray. She had no pain at all. We did an x-ray and there was literally nothing left of her knee joint. It was the cartilage had just been gone completely and she'd absolutely no pain. And of course, we've got this silly referral process whereby you have to fill out an Oxford knee score, which is all based upon pain. And I said, we're just going to have to play the game here because you need a new knee as much as the next person. Yet actually, you've got no pain at all. She got her new knee. Her life was transformed because she recovered really well. She was back on her bike, and the last time I saw her, she was delighted with the end result. But it's just I've never forgotten just the reality of the image is one thing, the symptoms are another. And yes, there's
really.
some overlap, but again, data, it's more it's an art of putting it all together and
I
knowing how
think
to
that's
interpret it.
in full circle. That's exactly the
Mm,
same with your Garmin watch. You've got to remember that it's a snapshot. It's not
mm,
real. It's just a collection of numbers, and it's how you interpret them for yourself, and where it marks you. Not necessarily. It's not a describer of you. It's a personal thing that allows you to see progress within
mm,
yourself, but it doesn't benchmark you against the population.
yeah.
People will say, "Oh, well, my Garmin says my VO2 is this and puts me, and I'm only in the amber zone."
Mm,
Well, it doesn't matter if you're in the amber zone. What makes a difference is, uh, are you going up the amber zone or are
mm,
you going down the amber zone? So I'm only really interested if you're going down the amber zone. I'm not really interested in what color you're in the first place. As long as you're staying
yeah.
still or moving forward, it's not about comparing yourself to the rest of the population.
Yeah. Yeah, I completely agree. So, I think there are very few true downsides to being active, but in my mind anyway, but it really depends on where you are on that spectrum of people in terms of what it means to you, what you've invested in it is a big part of it as well, and how much you push yourself. I think
Mm.
some people need an external push.
Yes, yes. But I think always remember that, like we said about my client, remember the huge gains that you made and
Mm,
where the progress that you made. And remember that it started in a place where you could only, where you are now is, I know that particularly with this client, where she is now, she could only have dreamt of a number of years ago.
mm,
But she feels now that she's letting herself down. But actually, compared to where she was, she's
mm,
massively ahead of where she was.
mm,
She's had huge successes, and to take it back to basics, and that, remember that consistency. When you need to get back on, you need to start again. Consistency is everything. And if you do 5 minutes today and 5 minutes tomorrow and 5 minutes the next day, that's all you've got to do. That consistency and
mm,
build on that consistency. And that's where the successes are made, in the consistency of what you're doing. Not necessarily how long it takes, not to do with how much you're achieving on compared to where you
Mm,
were before. But today is today. The past is gone. Let's look at today and let's look at tomorrow.
yeah, and I think that there is that. I can't remember who it was who said it, but you want to be doing this to the point that the day you don't, it feels a bit odd. Like if you forget to brush your teeth, it feels
Yeah,
a bit odd. Something's not quite right. And maybe
yeah,
it takes you a few minutes, depending on how foggy your brain is in the morning to realize what it is that you forgot. But it just feels normal, or when you've not quite locked the door. And I think that's what I work with people to try and build into their foundation, in that let's create the habit, and what you do in that window, we can always fine tune, dial it up, dial it down, but you want to get that habit embedded so that it feels normal, and being active is part of how you live normally, and that's how you'll get the most gains. I wanted a better word than gains.
indeed. So, I mean, we're coming to the end now of the podcast, I think, time wise. But we talked about previously that we were going to set each other challenges.
Yeah,
Have you got a challenge for me?
I have,
Oh, damn.
but it's equipment dependent.
Okay. Right. Yeah, mine's equipment dependent.
Yeah,
Go on. Go ahead. Go
it's
ahead.
quite simple.
Okay.
I want you to see if you can hang for 3 minutes.
Oh my word! I know I can't. I know I can't. So
Okay.
okay, okay. I have got a bar, and okay, hang. Is it
Or as
sort of
close to.
under grip or over grip?
Doesn't matter. See which is more comfortable. I don't think any way is easier.
Oh, hang on a bar. Okay, and I've got and I've got to build this up over 2 weeks, have I?
Yeah, well, 2 to 4 weeks.
Two
Yeah.
to 4 weeks. Okay. God, I hate this.
Timetables permitting. Yeah.
Right. Okay. Have you got access to a rower?
Only once a week.
That's all right.
Oh, God. Go on.
Okay. So I want you to give me your 2,000 meter. Is it concept rower?
Yes.
Yeah, okay. I want you to give me your 2,000 meter row time at level 8.
2,000 meter row time at level 8. I've just had a slight wave of nausea,
Yeah,
but okay.
okay. And to improve that, I want you to do then in between. If you've only got access to it once a week, I want you to concentrate on your barbell rows.
Okay.
Uh, and lightweight, high reps to get that. I know something that you won't. Yeah, I know. I
Yeah.
can see your face.
Another prickle down the spine there. Go on. Okay.
So I
Lightweight.
want you to do that on a regular basis and see. So first of all, let's get a benchmark of your 2,000 meter time, and let's see with barbell rows at high reps, low weight, if we can reduce that time. And also, so I want you barbell rows and squats with a low weight as well.
Oh, and they will improve my 2,000 meter row at level 8. Okay. We've
Yeah,
just had installed one of these concept rowers that's just the arm thing.
ski erg. Don't
Yeah.
worry, that's coming.
Well, okay. That was quite horrendous. We had a 100-meter challenge, and now she's changed it to how far you can go in a minute, I think.
Yeah, yeah.
Okay.
So my a good friend of mine that we should probably have on the podcast at some point holds the world record for the 24-hour ski erg.
What?
Yeah. So 24 hours on a ski erg. I think he did 227,000 meters.
Wow. So I have no reference for what a good time would be, and I'm just going to keep it that way
Good.
because I might
Good.
embarrass myself
Yeah,
or I might
I'm
do
not
myself
interested.
proud, but I have
Yeah,
no reference for that as to
yeah,
what
I'm
a good
not
time would
interested.
be.
All I'm going to tell you is that the 2,000 meter row, the first time you do it, will honestly, you'll think, is he trying to kill me?
Right.
But it is going to get better.
Okay.
In the same way as hanging from the bar.
Yeah.
I know exactly how that's going to feel. Yeah.
Yeah.
Okay.
Okay.
So
Great.
next time, what are we going to talk about?
Well, oh, I have got lots of ideas. I like the idea of, but it's probably more than one episode, but the crossover between exercise and mental health. I say mental health, that's very, very broad, but I do make a stipulation when I'm signing people off with stress that they incorporate at very least a 40-minute walk a day. And there's
Yes.
really good reasons as to why it's that time and why they need to do it. So that'd be good to pick up
Yeah.
and
Sure.
expand that from the patient population to the athletic population and why it's valuable.
Yeah, we can talk about the research that's around medication and
Mm.
then how that compares to exercise. But I would also say to anybody that's listening, if you've got anything that you want us to talk about, if you anything you want to know a bit more about, then just let us know in the comments, either on the podcast or on Instagram or any of the posts, on anything that you want to know a bit more about.
Yeah, I agree. I'd love to hear it. Definitely.
Fantastic.
Great. Right.
Okay.
I better
Till
go and
next.
start rowing.
Yeah, I'm going to hang around somewhere.